This segment brought to you by Sure Crop, liquid crop nutrition delivered right to your farm.
Hello and welcome to Horsing Around. I'm Dr. Chris Blevins here at Kansas State University Veterinary Health Center. Today, joined by Dr. Katie Delph. Welcome.
Nice to be here, thank you.
And Dr. Katie Delph is one of the assistant clinical professors here at the vet school and is boarded in internal medicine in the equine section. So I think one thing that you can help shed a lot of light on will be that of equine herpes virus. Could you just give us some information and why it's kind of a hot topic?
Yeah, so equine herpes virus, it can have different forms. So the most hot topic right now is the neurologic form of the disease, but it can also cause respiratory as well as abortion issues. And so commonly, or most recently, what we have going on are outbreaks. And so again, most recently they've been in California, Louisiana, and Kentucky. So there have been outbreaks occurring because of the highly contagious nature of this virus.
Now, when you say neurologic, I guess, what is that? Like, what makes it a neurologic problem? What does a horse show?
So the clinical signs that a horse can show if they are affected with the herpes virus causing neurologic signs are ataxia or incoordination of especially the hind limbs. They can be really weak in their hind limbs as well. And then other signs that we'll see may be like urine dribbling and inability to defecate appropriately. And in addition to those, sometimes they can actually show subtle respiratory signs or signs of infection, including having a fever, being depressed and appetent, and again, occasionally respiratory signs like nasal discharge.
Now, those are great information as far as what an owner would be potentially looking for. How would they know, like if they're at a show, like what to do next, I guess, kind of thing, if they're concerned with it, or what would be maybe the first signs that maybe they would need to get a veterinarian involved with diagnosis?
Yeah, so some of the first signs would be fever, and that can be a little bit tricky if you're not checking your horse's temperature, you know, every 12 hours or 24 hours. But subtle clinical signs would be, you know, your horse just isn't acting quite right, maybe has gone off a feed. That would indicate there is something going on. Again, more severe signs can happen pretty rapidly where they are uncoordinated or sometimes unable to stand. So anytime that the horse is not acting correctly, I would say to have a veterinarian involved, especially if it is, you know, at a horse show or something like that where there could be bigger issues to handle as well.
Now, how would they be passing it from one horse to the other? What's the biggest thing that's like causing the virus to move from one horse to the next?
Yeah, so it is secreted in respiratory secretions, so it can be in the air, but you also have to remember that it can be contaminated on surfaces, so like water buckets, in stalls, as well as our own clothing, our own hands. So certain times we could actually potentially spread the disease if we're not aware that we're carrying it around on us as well.
You know, that's interesting. You know, the virus can live outside the host for a little bit of time, and remembering that people can kind of transport it is something to keep in mind too. Well, I think the other thing would be just, I guess, with that, knowing that information, when to get your veterinarian involved, if they have a fever, if you have any questions, to sure have that. And it's not necessarily that we don't have herpes virus that's not neurologic around in Kansas too. So those things are stuff to definitely keep in mind. So thank you for being on the show. If owners have any questions, they're always welcome to give us a call here at the vet school. And that number is 785-532-5700. They can sure give us a call at any point and talk to one of the specialists here at the vet school with any of those questions, whether at a show or just at their barn or any questions about their horse. I'm Dr. Chris Blevins at Kansas State University Veterinary Health Center, and we'll see you around.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life, and a few years ago I had an injury that created what they call a frozen shoulder in layman's terms. It got to the point that I couldn't reach, I couldn't sleep, I couldn't do anything. After speaking with the surgeon in Tulsa, he finally told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. I decided that, maybe I better listen to my friend John, and I called Kansas Regenerative Medical Center. I talked to Patrick Farley and was just excited about the whole aspect of going up there and having the opportunity to focus on getting better. The next morning at 8:30, went into the clinic, did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. I feel better. We work around here. Some days we work pretty hard around here, and like any older guy does, I get pretty sore, pretty tired, but my right shoulder doesn't get sore. It's like a baby's arm.